Kenya has a big nutritional problem. Basically, we have malnutrition in children and in pregnant and lactating mothers. And zeroing into your question about anemia, it is one of the micronutrient deficiencies of public health importance in Kenya. It is a big problem, especially amongst pregnant women and the under 5 children. Using the last most reliable data that we had, that is quoting the 1999 data, we had 45% of pregnant women having iron deficiency anemia. And that really is a huge proportion of women of Kenya not having adequate HB levels. And it's a concern because going into labor with low HB levels really can create a big emergency. We also have a big problem amongst the under 5s, and specifically that what bothers us even more is children who are below 6 months, who are supposed to be on exclusive breastfeeding, also have anemia levels recorded, meaning they must have been born with low HB levels. So really, this is a big area that we really want to look at and tackle. And we believe that the way to really start looking at this issue is from conception. Therefore, we must begin to look at the mother herself in issues of maternal nutrition. Yeah, the multi-stakeholder meeting was called after reviewing the findings. We actually took a little longer to respond, especially after the 1999. But what came out from the last survey that was looking at the service providers assessment, the Kenya Service Provider Assessment, it was clear that these are areas of service delivery that are lagging behind. And also looking at the malaria indicator cluster survey of 2010 again, that continued again to show the same pattern, that in spite of the use of net coverage going up, the anemia levels were still high. The malaria had gone down, but the anemia was still high. So clearly, the message was, there's something that we must do around nutrition. So this stakeholder workshop actually was called, and through it now, with the very broad participation, what was decided is that we must have a plan to be able to address the issue of anemia in a very structured manner. The result of that was the 5-year, multi-year anemia reduction action plan. And amongst these, some of the things that are coming up very strongly, one, the supply chain had to be addressed. Second, the information and the knowledge about iron and folic acid must be known to health workers and to mothers. So the whole issue of behavior change communication was actually key. And with that, they were actually saying that if we can be able to focus on the areas of knowledge, on the areas of attitude, on the areas of logistic management, and then on the area of documentation. Because if you give and you're not documenting, you may not know what really you are doing. Then, if we address those key areas, we can be able to document and say where we are moving. So that multi-year plan now gives us a roadmap of what we are going to do in the next 5 years in terms of tackling anemia in this country.